Hi everyone, this is Dr. Paul Helms, DC from Columbia Sports Chiropractic. So today we're going to be talking about how to handle a low back spasm, or more commonly called throwing out your back. And this can happen in a variety of ways, but probably the most common one is where someone is bending over, reaching down and grabbing something, usually it's pretty light, and then they start to feel acute distress and pain in their lower back, which really causes a lot of issues moving around, as well as distress when they're trying to perform daily tasks. So to help manage this, some things that we can just do starting immediately are some exercises and drills to relax those muscles through the lower back, as well as to set yourself up so that this is preventable as possible for the future. So to start, we're going to be laying on our back with our knees bent. Now, it should be said that this protocol is primarily for folks who do not have radiating leg pain. This is for folks who just have localized low back muscle spasms. So if you have radiating leg pain, you will definitely need to be seen and evaluated to ensure that nothing else is happening throughout your spine that would merit more advanced care. So while I'm laying on my back right here, I first need to start just by essentially trying to relax my whole body, not just my low back muscles. Because typically when this low back spasm occurs, we start to go into essentially a fight or flight response. We get a lot of muscle tension because we're experiencing pain. And the best way to bring that down, both our worry about the pain, but also just the tension itself, is to use diaphragmatic breathing. To do that, I'm going to be laying on my back. One hand is on my stomach, one hand is on my chest. As I inhale with this bottom hand, I'm going to inhale, raise the hand up, exhale, relax. Inhale, raise the hand up, exhale, relax. And I'll keep on doing this for about 10 to about 20 breaths, gently inhaling and exhaling. And then as I'm doing this, I'm also trying to mentally just allow these low back muscles to just let loose and relax. Well, it sounds pretty simple. You can actually do a whole lot of good in terms of just trying to selectively relax certain muscles in your body. And low back is an area where this is actually very effective for us. Now, after doing many of these diaphragmatic belly breaths, then I'm going to focus on trying to restore range of motion into my spine. So now I'm going to place my hands on my hips, and now as I inhale and then my stomach, I'm going to ever so slightly tilt my pelvis back up this way. So imagine like my pelvis is a bowl of water, and that every time that I tilt my pelvis back this way, I'm spilling the water back onto the ground. Whereas if I go the other way and tilt the pelvis forward, that water is then going up towards the ceiling. So hanging out here, I'm going to inhale, I'm going to tilt my pelvis back, exhale, relax. Inhale, tilt my pelvis back even more, exhale, relax, and then inhale, tilt my pelvis back as far as I can go, almost to the point where I'm raising my tailbone and my hips off the table. Now, that would likely occur after about 10 to 20 reps of that, slowly trying to increase the range of motion every single rep. Now we need to make sure that we can have a little bit of a braced midsection with movement, because this will also be important for getting in and out of positions during the duration of a slow back spasm. So we're just going to practice a glute bridge, but also note that if your spasm is acute enough, you might not be able to do this. So only do this if you can inhale and brace your midsection without pain. So first, I'm going to brace that midsection, stabilize my rib cage, low back, and pelvis all as one unit. So I'm going to inhale into my stomach, tense my midsection like a brace for a gut punch. So I hold this kind of 360 tension all the way around. And then I'm going to squeeze my glutes, raise the hips up, hold it briefly, lower on down, exhale. And do it again. Inhale, brace the midsection tight, feel that lateral tension all the way through, squeeze the glutes, raise the hips up, lower them on down, exhale. And I would repeat this about 5 to about 10 reps. But again, this should not exacerbate low back pain. If it does, skip this step. Again, if this causes low back pain, skip this step. Now I need to start mobilizing my back into flexion, but also extension. So I need to restore that healthy kind of range of movement. So to do this, I need to get into a hands and knees posture. So I'm going to inhale, brace the midsection tight, roll myself onto the side, inhale, brace myself again, and then I'm going to rotate my body onto hands and knees. Notice how I kept my shoulders, rib cage, low back, and hips all as one functional unit. This safeguarded any kind of unnecessary or jarring movement that could go through our low back and spine. We do want to restore movement eventually, but we want to do it very gradually and very gently. We want to avoid sudden movements that can occur when we're changing positions. So on all fours right here, as I inhale, I'm pressing my stomach down and rounding my back and pressing it up towards the ceiling. So inhale, round the back, tilt that pelvis back. Exhale, arch the back and tilt that pelvis forward. So all the movement is essentially originating from our pelvis right here. So here, I'm just having my hand here just to kind of demonstrate the movement. Normally you would have both your hands on the ground, but if you do need to kind of feel that pelvis move, feel free to have your hand here as you gently go through this range of motion. And after about 10 to 20 reps, we should gradually increase in range of motion and improve your ability to withstand this kind of movement pattern. Now, this is a general triage and strategy to deal with any kind of acute low back pain that comes from a sudden onset of activity. Again, it should be stressed that this is only for muscle spasms of low back. If you start having any kind of radiating leg pain down your leg, any numbness or tingling, then that's when you want to go immediately to a medical professional. All right, this is Dr. Paul Helms from Columbia Sports Chiropractic, signing off.